Okay, so you can see that I don't have makeup on, and I just wanted to show what I actually look like without makeup. I get a lot of people tell me in the day, like, oh, you look great, which is nice because nobody wants to look sick. But I think it's important, especially watching back my old videos, that people see what I actually look like without quite a thick layer of makeup. So one thing I wanted to show was my eyes. So this has improved quite a lot because it happened on Sunday, but if you can see on my eyelid, I have this mottled appearance, and actually that's on all of my skin. This is a spider vein which you get when you have liver disease. I'm not sure why. And then I have a slight yellowing of my eyes, which hopefully the camera will focus on. And then obviously this mottled skin and dark circles. The dark circles are obviously because I don't sleep. And the mottled skin is called Purpura, I think. But I was sick on Saturday actually. And one of the problems with having a low platelet count is that when you're sick, you can do quite a lot of damage to your blood vessels. They burst, they're not able to repair themselves, and this is what you can see. So these are actually tiny pinpointed bruises that come from me having been sick on Saturday. So I wanted to show this because I cover it up obviously every day, and you can still see it a little bit with my makeup on, but it kind of just looks like freckles, so I'm not so bothered. But yeah, my skin is actually really quite bad, and a lot of that has to do with the liver disease. So like I said, these spider spots, I have one just here as well. They'll never go. I have very cracked lips because I take diuretics, so all the moisture is taken out of my skin, and everything's very dry. I have a lot of dry skin on my arms. I have a medicated moisturiser from the dermatologist, and yeah, so that's kind of just what I wanted to show. Okay, so now I have my makeup on, and hopefully you can see a difference. You can still see a little bit of the issues I showed you before. I have actually been out since I put my makeup on. I didn't have time to film between putting my makeup on and this video. All in all, it's much less noticeable and I feel much more normal. I don't tend to like to cover everything. I don't think it's necessary. It looks a little bit like freckles, I think. Well, that's what I tell myself. And yeah, so this is it done. This is me ready for the day, and hopefully you can see a difference. One thing I wanted to mention, especially about skincare, is that when you have AIH, the medication you're on can really affect your skin and your hair. So my hair is quite fluffy and broken and dull. It doesn't look too awful because I washed it this morning and I put a lot of conditioner in. But the medications such as the diuretics really dry everything out. And I don't know if you can see on my arm, but I have very dry skin here. You can see a little bit, there are some issues. And this is down to the diuretics. So I have a prescription for a very high fat moisturiser, which is supposed to really help the skin, and I get that from my dermatologist. And I've seen a dermatologist every 6 months since I was diagnosed, mostly because of the drugs that I was on. So I showed you before Imarec. So the actual compound name for this drug is azathioprine. I think I pronounced that correctly. But this drug gives you a much higher chance of getting skin cancer. So you know you're in trouble when a medication that really raises your chances of cancer is seen as the lesser of two evils. So once you're on this drug, it's very important that you see a dermatologist every 6 months to have any moles checked. Quite a number of people in my support group have had small skin cancers. A lot of them are benign, and they're found quickly and they're removed, but some of them can be aggressive and malignant, so you need to have this constant follow-up so that anything they catch or anything that appears can be caught very quickly. So yeah, if you don't have a referral to a dermatologist, I highly recommend that you get one. Your hepatologist should have told you this or should have recommended it. In my case, it was my general practitioner, or my family doctor as they call it here, who gave me that prescription. So that's everything for today. It's just really to talk about skin and show you the different things that I deal with and use makeup to hide. So I hope you all have a really nice day and rest of the week.